Hello all, this is Mrs.Lalithamani, Associate Professor from SNS College of Nursing. Every month we are learning into a new lecture series of different topics. In this lecture series we will be learning about the ICU equipments, where we will be learning about many equipments that are mandatorily kept in an ICU. First one is, when we think about any scenario, a patient coming with a severe pneumonia is admitted to the ICU because their oxygen levels are critically low and require mechanical ventilation to support their breathing. So in this scenario, what ICU is mandatory to hold and how they can provide the care for this patient. The need for ICU stay is prioritized based on the severity of the disease. So we know that when a patient is coming with an airway, breathing or circulatory problems, there is a need for ICU stay. So let us see the equipments that will help in patient to retrieve from the breathing difficulty. First one is a CPAP, that is a continuous positive airway pressure unit. So here a CPAP machine keeps airways open while patient sleeps, so he can receive the oxygen need. So even when the patient is sleeping, there is no need for the patient to make a strenuous effort and breathe. So the CPAP machine will make sure that there is a continuous positive airway pressure inside. So in this patient who are deprived, who has sleep apnea, can be put in this CPAP machine. Second one is an AMBU, that is a very familiar name, which is called as artificial manual breathing unit. It's a device used to provide respiratory support to patients in emergency and non-emergency conditions. Even that can be used during a patient shifting, or even when the patient is being transferred from one ward to another ward, or during an ambulance, or even when the patient is having a emergency setting which the patient need to be shifted to a hospital for first aid. So then next will be a mechanical ventilator, a medical device that assists a patient with breathing by moving air in and out of their lungs when they cannot do so adequately on their own. So when the patient is not able to do spontaneous breathing on their own, this mechanical ventilator should be supported. So the ventilators provide necessary oxygen, remove carbon dioxide, and can keep air sacs open. So this mechanical ventilator is an equipment which will be kept for assisting the patient to breathe totally. Next one is bedside continuous monitor, an instrument that is connected to the patient's bedside and can continuously monitor the various physiological parameters or certain states of the patient. So when we see a bedside monitor, continuous monitor, you can see in the image that is a pulse rate, oxygen saturation, then we can see the waveform for breathing, respiration, and the waveform for oxygenation supply, and the blood pressure also can be monitored along with that mean arterial pressure. And then the thing next one will be the administration of medication. So we have an emergency crash cart which can be placed at every unit so that any emergency can be handled. So it is a set of trays, drawer, shelves on wheels used in hospitals for transportation and dispensing of emergency medication or equipment at the site of medical or surgical emergency. For the support protocols, that is ACLS or ALS, that is acute coronary life saving moment, or ALS, to potentially save someone's life. So when a bedside patient, a patient is collapsing inside the room, the first and foremost equipment to be shifted will be the emergency crash cart, that too in case of ward setup. So the next one is infusion pumps. An external infusion pump is a medical device used to deliver fluids into the patient's body in a controlled manner. So when the patient is being administered an IV fluid, for example, if a 500 ml bottle is being administered over 8 hours, it can be managed with a drop rate. But if a 50 ml has to be administered, 50 ml of medication has to be administered for a 8 hours duration, so the minute calculation has to be done, the minute drop rate has to be calculated so that it can be delivered efficiently. For that, infusion pumps are used. So far in this ICU equipments session, we are learning about what is the case scenario when a patient is coming into an ICU, and a mechanical ventilator, CPAP machine, and AMBU. We have seen about the infusion pumps, we have seen about the emergency crash cart, and so on. So just to do a recap, we will see in the next session. Thank you.